If someone told you, "We will treat you for free. We will give you hot meals, transportation money, and burial insurance for your family," would you believe it? 399 men in Macon County, Alabama did. They were poor black farmers, mostly illiterate, with no access to hospitals and no money to buy medicine. In the context of the Great Depression in 1932, a promise of free treatment from the U.S. government was something they could not refuse. They did not know that they would never be treated. They did not know that they were being observed like laboratory rats. They did not know that even when a cure became available, it would be deliberately kept out of their reach. And today, we will learn about the Tuskegee Experiment that lasted for 40 years. To understand why the Tuskegee Experiment could happen, you need to understand what Macon County looked like in 1932. This was one of the poorest counties in Alabama, and also one of the poorest in the United States. Nearly 80% of the population was black, most of them descendants of enslaved people, working land they did not own under sharecropping. They paid rent with a portion of their harvest, year after year, trapped in a cycle of poverty with no escape. The nearest school for black children was miles away. The nearest hospital? They were not allowed in. Under segregation, legally enforced racial separation, black and white people lived in completely different worlds on the same land. And in the world of black people in Macon County, illness often meant death because there was no one to treat them. Syphilis was particularly rampant in this region. It is a sexually transmitted disease that, if untreated, destroys the nervous system, blinds its victims, damages the cardiovascular system, and eventually kills after decades of suffering. Federal health officials knew this, and they came to Macon County, but not to treat. In 1932, the U.S. Public Health Service launched a study officially titled Study of Untreated Syphilis in the Negro Male. The title said everything, but none of the 399 men selected knew it. They were told they were being treated for bad blood, a vague local term used to describe various conditions, including anemia and fatigue. None of them were informed that their actual disease was syphilis. None were told that the study had no plan to treat them. The real objective was to observe how syphilis progressed in black men without medical intervention, and to compare it with data from white patients previously studied in Oslo, Norway. In plain terms, the U.S. government wanted to watch how people died from syphilis. And they needed people who could not refuse, who lacked the power to resist, and who did not have enough information to know they were being exploited. The 399 black men in Macon County were the perfect choice. Eunice Rivers was a black nurse who graduated from Tuskegee Institute. She was the only bridge between the local community and federal officials from Washington. For 40 years, she visited participants at home and transported them to medical examinations. She reminded them to take their medicine, actually ineffective aspirin and vitamins, and explained that this was how the government was caring for them. She was not a villain in the conventional sense. She was a black woman in a system designed so that she could not see the full picture. But her name would forever be tied to this experiment. In exchange for their trust, the participants received a hot meal on examination days and transportation money, carefully packaged aspirin, and a burial insurance policy worth $50 so their families could afford to bury them when they died. Burial insurance. They bought the silence of dying men with the promise of a proper funeral. This was the moment when the Tuskegee Experiment crossed from unethical to deliberate crime. In 1947, penicillin was widely recognized as an effective cure for syphilis. No longer experimental, no longer theoretical, this was a treatment that was effective, safe, and inexpensive. The entire U.S. healthcare system began using penicillin to treat syphilis nationwide, except for the 399 men in Macon County. The researchers did not simply continue observing without intervention. They actively prevented the subjects from accessing treatment. During World War II, when many of them were drafted and underwent military medical screening, their names were flagged to ensure they would not receive syphilis treatment. When local public health campaigns organized mass testing and treatment, Tuskegee officials intervened to ensure the subjects were excluded. They were not left to die, they were protected from living. Each year, the subjects came in for examinations. Each year, they had blood drawn, underwent neurological exams, and sometimes spinal taps, not to treat, but to measure disease progression. A spinal tap is a painful and invasive procedure. It was described to the subjects as special treatment. That was how they described inserting a needle into the spine of a dying man, not to save him, but to measure how far death had progressed. Over 40 years, 28 men died directly from syphilis, and 100 from related complications. 40 wives were infected, and 19 children were born with congenital syphilis. These numbers are not statistics, they are names of real people. Peter Buxtun was an epidemiologist with the Public Health Service. He learned about the Tuskegee study in 1966 and immediately felt something was deeply wrong. He wrote internal reports, raised concerns, and argued that the study violated basic medical ethics. The response he received was, the study was too scientifically valuable to stop. In 1972, after years of being ignored, Buxtun decided to go public. He gave documents to journalist Jean Heller of the Associated Press. On July 26, 1972, the story appeared in hundreds of newspapers nationwide. America was shocked, not because they didn't believe it, but because they believed it immediately. And that meant everything they thought impossible had actually happened, for 40 years, in plain sight. The study was shut down shortly after, too late to save those who had died, but 74 men were still alive. The most important thing about the Tuskegee experiment is not that it happened. It is who allowed it to happen. This was not the secret operation of a few rogue doctors. It was a federally funded program, managed by the U.S. Public Health Service, an institution meant to protect public health, and published in respected medical journals for decades. In 1936, an article about the study appeared in the government journal Venereal Disease Information. In 1946, another article was published. In 1955, another. In total, more than 13 scientific papers were published about the Tuskegee study before it was exposed in 1972. The medical community knew, fellow researchers knew, journal editors knew, and no one stopped it. Charlie Pollard, one of the survivors, was interviewed after the story broke. He said, "I knew I had been used. I knew it for a long time, but I didn't know what to do because it was the government. You can't fight the government." He said that in his 70s, after living with untreated syphilis for decades. In 1973, a class action lawsuit was filed on behalf of the victims. In 1974, the U.S. government agreed to a $10 million settlement and promised lifetime medical care for survivors and their families. No one was criminally prosecuted. Not a single doctor or official went to prison. It was not until 1997, 25 years after the study ended, that President Bill Clinton issued an official apology. Standing before survivors and families of the deceased, Clinton said, "What the United States government did was wrong. I am sorry." 8 survivors were well enough to sit in the Oval Office that day. The oldest was 94 years old. He had waited 65 years for that apology. The consequences of the Tuskegee experiment did not end in 1972, nor in 1997. A 2016 study published in the American Economic Review tracked health data of Black Americans over decades and found something striking. After the Tuskegee story broke in 1972, middle-aged Black men sharply reduced doctor visits and never fully returned to previous levels. Researchers estimate this decline in healthcare usage may be linked to tens of thousands of preventable early deaths. In other words, Tuskegee did not just kill 128 men, it killed trust. And that loss of trust killed others, for decades afterward, in ways no one can fully measure. When COVID-19 emerged in 2020 and vaccine hesitancy among Black Americans was significantly higher, many researchers pointed directly to Tuskegee as a root cause. An experiment that ended in 1972 was still shaping medical decisions for millions in 2020 and 2021. That wound did not heal, it simply became quieter. The Tuskegee Experiment is not just a story of the past. It is a question of power. Who decides who is worthy of protection? It is a question of complicity. How many people knew and said nothing? It is a question of institutions. When an organization meant to protect the public becomes harmful, what stops it? And most importantly, it is a question of memory. Events like this do not happen because of exceptionally evil individuals. They happen because of hundreds of ordinary people, doctors, nurses, officials, editors, who convince themselves daily that this is valid science, that the cost is justified, that it is not their responsibility to stop it. Hannah Arendt named this when writing about the Nuremberg trials, the banality of evil. The greatest evils in history are not carried out by monsters. They are carried out by ordinary people in ordinary offices, signing ordinary papers and going home to dinner with their families. 399 men in Macon County placed their trust in the system. The system betrayed them for 40 years. The question is not whether it could happen again. The question is, what are we doing to ensure it does not? Thank you for listening to the full story, and don't forget to like and subscribe to see more videos.